with clinical study 1. The first clinical study was done in December 28 to March 29. It was a duration of 4 months, and it was done by the request of the then Vice President, Dr. Aissatou Ndiaye Seydi, which was the first clinical study conducted in the Gambia on FGMC with health consequences. And the study was done in all regions of the country. The objective of the first clinical study, to identify demographic, ethnic, and clinical variables in relation with health-related consequences. And the second objective was to identify the relationship between FGMC and also health-related consequences. And the population was 871 women and girls who sought consultations. These were women with gynecological consultation problems, and they needed consultation from the doctors. And data was collected by Cuban doctors. By that time, they were decentralized all over the country. And the result of the first clinical study. The study showed that type 1 FGMC was the most prevalent type in the country with a percentage of 66.2%, followed by type 2 and type 3. The result, FGMC types and complications. Here we have the complications as immediate complications and long-term complications. And out of the 871 studies, 110 came out with immediate complications and 189 came out with long-term complications. And in summary, 1 out of every 5 girls and women came out with FGMC complications. And with type 2, 1 out of every 2 girls and women came out with FGMC complications. And immediate complications by age, here we have the age as 0 to 14. And the ethnic group studied were as follows. With result with the obstetric and sexual complications. Here the complications we had were abnormal scarring, retraction of the tissue, and also organic dyspareunia. Here we can see all the arrows are pointing on organic dyspareunia, which simply means painful sexual intercourse. These are due to the procedure. And conclusion of the first clinical study. The study shows that FGMC was still practiced in all the 6 regions of the country, and type 1 was the most prevalent. With type 3 were unexpectedly found in West Coast and CRR. They are unexpectedly because it was not common, and most of these cases were type 2 leading to type 3 due to not managing the type of FGMC they did. And complications by type, all forms of FGMC produce significantly high percentage of complications. And type, and 1 out of every 3 women and girls who had any form of FGMC came out with complications. With relevant complications during the study were hemorrhage, leading to anemia, abnormal scarring, especially fibrosis. With the infections, we have lower urinary tract infection, septicemia, and also tetanus, and finally vulvovaginitis. Now we are in the second clinical study. The second clinical study was the first clinical study conducted in the Gambia, exploring FGMC impact on delivery and also newborn. Here, the study we are looking at the impact of FGMC during delivery, not only on the mothers but also with the newborn. And the study was done in West Coast Health Region. The objective of the study. The purpose of the study was meant to gather information on the complications of FGMC during delivery and also with the newborn. And the other objective is to build the capacity of midwifery students in the field of research. The population, the sample size was 572 women who came to the hospital and health center for antenatal care or delivery and that have undergone FGMC or not. Because the study was done on women that have undergone FGMC and women who have not undergone FGMC. And the data collection was done by midwifery students of the enrolled community health nurses. By that time, they were on their practicum, and the whole process was supervised and monitored by their tutors together with Wassu Gambia Kafo'S trainers. And the result with complications during delivery. The study showed that women with type 2 FGMC were having more complications during delivery. And some of the complications during the study were perineal tear, episiotomic practice, and also fresh stillbirth. And the complications on the neonate, we are seeing that women with type 2 FGMC were having babies with more complications of FGMC. And conclusion of the second clinical study, women with FGMC are 4.5 times more likely to have babies to have delivery complications and also babies with health-related complications. And these complications are due to the loss of elasticity of the sexual organs produced by FGMC, such as fibrosis and also synechia. All forms of FGMC, including type 1, also produce significantly high percentage of gynecological complications. And general conclusion, the study demonstrates high magnitude of health-related consequences in girls when FGMC is practiced, and also in women all lifelong, in particularly during delivery. And with the newborn, due to a prolonged and obstructed delivery, and also these delivery are due to FGMC being practiced by their mothers. And after the clinical study, we see it as a responsibility and we see it as a need also to train professionals, these health professionals, in order for them to identify and manage the complications related to FGMC. Because before they were seeing these complications, but they could not relate it to FGMC. And we see it as a need that we have to engage them, we have to train them for them to identify and also manage the complications. And also to control, sensitize, and prevent. And also to let them know, and also to train them not to medicalize FGMC. And impact of the study. The study impacted in 2011 the colloquium of West African religious leaders with regard to the promulgation of the fatwas. In 2011 to 2016, training of religious leaders in the Gambia, opening a space of dialogue about the negative consequences of the practice. And in 2011 to 2020, design and implementation of the National Training Program through the Ministry of Health and Social Welfare. And in 2015, by providing evidence on the Gambia government and also National Assembly members in order to enact the law banning FGMC. On that note, I thank you for your kind attention.